Hi, I'm Dr. Dadvand. I'm a board-certified plastic surgeon here in Beverly Hills, and I want to do a case study video where I take you through my analysis of a patient that underwent top surgery and then their longer-term results. Now, this patient, I recorded their surgery initially and showed about 6-day follow-ups, and be sure to click the link if you want to see that video in its entirety. But today I want to show the longer-term results and where this patient is headed in their recovery. So top surgery is for patients who are either transitioning or just unhappy with their breasts and want a more masculine presentation to their chest. And here you can see the before and after pictures, but let me zoom in on the before pictures and go through them so you can see how I analyze this case. So this patient came to me and wanted a masculine chest, and automatically you see that they have a really large pendulous breast. And so for these surgeries, you can't do small incision keyhole surgeries to take care of it because there's just too much extra skin. And obviously where the nipples are pixelated here, you can see that they're just too low compared to where they need to be. They need to be more up here. And so my first analysis is to determine what type of surgery they need. And so this patient needed a double mastectomy with free nipple and free areola grafts. Now, obviously in this case, because this is pixelated, the one thing you cannot tell is that this patient also had very large nipples. And so I had to do a separate areola and a separate nipple graft to make them match and look more cohesive as a male nipple and areola. And so that's what I see on the front view. Breasts are way too low here. They're by the elbow crease here or just above it. Nipples are too low. They need to come up. And you can see as I go to the 3/4 view and again to the side view, the same thing. Really pendulous. This angle is just wrong. This needs to be removed and make a more masculine chest with a nipple in a higher, more lifted position. So that was my initial analysis, and then just needed to go and do the surgery. So here we are now at 6 months. Now in the initial video that I recorded on this patient, the results were only at 6 days, but here the patient is at 6 months. And so one thing right off the bat is the final scars take usually about 1.5 to 2 years to get to the final color. So there's still a little bit of redness that you can see on the front view as far as the incision. That will fade with time, but automatically you see such a better, more masculine presenting contour to the chest. No more pendulous breasts here, but also look at the nipple position. Before, the nipple was right here, almost like the tail of the scorpion on this tattoo, and after you can see it's much higher, more male aesthetic. But the other thing I want to show you is I'm going to zoom in on this front view here, and this is actually a separate nipple and a separate areola graft. So what I do in the operating rooms, I make the areolas smaller, but then I also take a little piece of the nipple and I graft them together. And this patient had really excellent take of both the areola and both the nipple grafts. And you can see that this is a perfect combination of those two to make it more male. If I just took the original nipple with the areola, it would have been just too much nipple for this patient. And so that's one nuance to this surgery that I've developed over the years to really customize the surgery for these patients. And again, if you look at the 3/4, the incision placement is also very important. You see, I like to curve that incision where it is around the pec, the bottom of the pec border. It's really important to do that. You don't want the incision to be going down this way or straight like this. It has to have a nice gentle curve to transition from under the pec to that side chest. And so I'll show you again on this profile view here. Again, the breast came down to about this part of the snake, and then now you can see that the incision is on this part of the snake, and the nipple position is so much better. And from the profile, that nipple projection is perfect for a male nipple projection. You don't want a male nipple to be too projected, but you also don't want it to be completely flat. So this patient had an excellent result as far as the nipple graft and the areola graft take. And so you can see this patient did really well with the surgery. The results are just going to get better as the scar matures and fades in color, but the contour is going to be there permanently, and they can decide to build their pecs in the gym if they want, but it wouldn't have mattered if they did that before surgery because the breasts were covering the bottom half of the pecs. And so this patient's doing great, and I'm really happy for them. So the key points for this case were, number one, this patient needed a double mastectomy, not a keyhole approach, because they just had too much extra skin and very low nipple positions. Number two, they needed a separate nipple and a separate areola graft because the nipples were just too big to be taken along with a smaller areola. It would have just been out of proportion. And then number three, making sure that the incisions were marked so they landed right at the bottom of the pec and curved nicely around the bottom of the pec. And so those were really the things that I was analyzing in this case, and I was able to accomplish them in the operating room. So I hope this case study was helpful for you guys, and I'd be happy to answer any other questions you may have about top surgery in the comments below. Until next time, guys.